So,
Yeah.
please, Anders, the floor is yours.
Thank you.
You will talk about the digital health lab.
Thank you. Good morning. Yes, it's still morning in English at least. It is always a challenge to speak in connection with lunch, but it would be to do it before lunch than after. Well, it should have a slide here. Not really sure actually how I will get it. Yeah, it's probably this one. Yeah, sorry. Oh yeah, okay. Well, I'm Anders Carlsson from Digital Health Lab in Norrköping. The manager of the lab, Per-Olof Sjöberg, could unfortunately not be here today, so I will do this presentation. This is actually an entirely new thing. Here you can see our CEO, Christer Nordström, together with the municipal commissioner of Norrköping during the opening ceremony. And we also had a lot of people there, a great audience listening to presentations and being there for networking. So why do we start a new lab? Actually, the reason is that we see a lot of problems ahead in the health area, especially those connected with an aging population and increasing healthcare and social care demands. But it could also mean a great opportunity. If we in Sweden, as a small and innovative country, could create good solutions, we have a huge international market because the aging population is very much a global thing. So that is also reflected in the agenda, actually, which has been created by SICS and coordinated by SICS with some funding from Vinnova. And it is the strategic agenda for eHealth for improved home care, with a vision of more healthcare and social care in other places than the ordinary institutions. And the home could also be a boat. I like this slide very much, and I like boating. So, at least temporary, it could be a boat. And this guy here, maybe he's doing some health stuff on his iPad. I'm quite sure he does. I'm not going to tell you all about this agenda, but you can find it on the web. But I at least should mention about the interaction thing, which I think is a very important part of it, when it comes to new business models and understanding the needs and the opportunities. I think we have heard more about earlier today about different business models, but I think that's a very, very big issue these days in all branches. Another thing is international standards. It's very important for the companies to be able to compete on equal terms with companies in other countries, and also for interconnection of different solutions and building more integrated systems, which we can test in test beds, where we also can interact with real people. Just a couple of examples of projects currently running in the lab. One is the COPD project, where we focus on people with chronic respiratory insufficiency. where we have created a telemedicine platform and system where different care providers can cooperate and where data can be collected from the home. Another one is SAFE, in which I'm personally heavily involved. It has not started yet. It will start next month. It is also about coordination and cooperation in the care sector between healthcare and social care providers, but also informal carers. It's a portal for cooperation. It is a European project coordinated from the Netherlands, where we actually have the core development part together with a company, Gaia Systems in Norrköping. And in that project, we utilize one of our main assets, which is a test bed, a test environment in the city of Norrköping in 2 residential areas where we have a population, very old population. And in fact, we have 800 people above the age of 80 in these residential areas. And currently, we have 70 of them educated on surf pads, and most of them also own one. This is one important platform, I think, for the old population to use, and we have seen very interesting effects. We have heard the ladies and the gentlemen saying that we have got a new life thanks to these devices. But it could also be a platform for communicating with care providers, for example. So that is one reason for establishing the Digital Health Lab in Norrköping. We have this environment, which is unique in a European perspective as well, because it represents the demography that we will have all over Europe in 2060. So it's the future we have here. And it is not a coincidence that we have this lab, the core of the lab in Norrköping. There is a prehistory, and that is New Tools for Health, which has been operated as an innovation initiative in East Sweden, Östergötland, since 10 years. And where we have worked with promotion of innovation and supported the different innovation projects with funding from Vinnova and also from the region. And we have seen and participated in the development of 70 new products and 29 SME companies. And a very nice thing with this establishment of the Digital Health Lab is that the New Tools for Health will continue, but now as a national initiative, with a slightly different approach, not only focusing on innovation support, but that we do in the SICS part very much. But this association is hosted by SICS, but here we will work more on the customer side and try to promote and inform about the possibilities. And it is a problem. It has been very, very difficult to establish this market. It is a difficult field. So we need to encourage the different actors to really start to buy the solutions and try to use the solution in real environments. So we have the aim to contribute with knowledge and about digitalization in specific, because ICT, we believe, as a great enabler in this area. And we would also like to gather enthusiastic people, as we say in Sweden, to really help us informing about the possibilities. And we also see another interesting spin-off, and that is new projects for Swedish ICT, because I'm quite sure that we also will see innovation opportunities working with this association. Well, it's a lot more to say, but I would welcome you to the different tables that we have with the focus on eHealth here today, and it's 6 tables. And yeah, a couple of them are about projects that I've mentioned, but you also have other things there to see and discuss about. So you're very welcome. Thank you very much.
Thank Thank you, Anders. This ends this session, and now you're welcome to the exhibition and some food also. But please bring your jackets upstairs. We will not have any... take the jacket upstairs. Thank you very much.
Det gick ju bra.
Ja,
Det är den sista minuten där.
jaha, precis. Ja, men sorry att jag missade det där. Jag glömde det. Ja, men ja, vi ses där uppe sen. Ja. Då lägger jag bort distributionscenter här och stänger ner dem. Right? Så ja.
Vad fan var det för problem? Var det någon sladd?
Ja, där i början.
Ja.
Ja, det var